Hello and welcome to this final course in our Healthcare Data Literacy specialization offered by UC Davis. My name is Brian Picciotti, and I have over 15 years of experience working as a data scientist within the healthcare industry. For those that joined me in the first course, my story hasn't really changed much, but for those that just joined me, let me catch you up on my career story. I started my career with an interdisciplinary PhD in human ecology from the University of California at Davis. In my dissertation, I used ethnography and games from the field of behavioral economics to understand cooperative ethnic groups in Tanzania, East Africa. After being accused of being a CIA spy by the Tanzanian government, I left the country and analyzed homicide data. After graduate school, I was interested in applied aspects of research. Thus, I earned a Healthcare Informatics master's degree from UC Davis in 2010. In my thesis, I used data mining techniques to understand the quality of administrative hospital data. With an informatics degree and a strong research background related to organizational behavior, I have enjoyed a variety of employment adventures. First, I worked for the state of California to use administrative data and vital statistics to create hospital-level outcomes reports. Second, in 2010, I joined the bioinformatics group at UC Davis to provide informatics and statistical services to autism researchers. Third, I joined the UC Davis Institute for Population Health Improvement, where I created analytical reports to understand health disparities and high-cost patients among California's Medicaid population. Fourth, continuing with Medicaid research and data science, I worked for a health analytics company called Optum, where I worked to continue analytical work consulting with California's Medi-Cal program. Throughout these interesting positions, I was Vice President of Analytics for a healthcare analytics startup company. In this course, we're going to go over analytical solutions to common healthcare problems. I will remind you of these business problems, and you'll build out various data structures to organize your data. We'll then explore ways to group data and to categorize medical codes into actionable categories. You will then be able to extract, transform, and load data into data structures required for solving medical problems, and then be able to also harmonize data from multiple sources. Finally, you will create a data dictionary to communicate the source and value of data. Creating these artifacts of data processes is a key skill when working with healthcare data. The format of the course is primarily video lecture-based with a lot of in-video and end-of-module quizzes to make sure you're able to understand and apply these concepts that we've been discussing. There is also a 4-part project that I've spread out into various modules to help you build your skills throughout the course. In Part 1, you will review output from real-world provider profiles and risk stratification projects. Next, in Part 2, you will access open-source grouper software and evaluate how granular medical codes and concepts are grouped into more meaningful categories. In Part 3, I will ask you to create an analytical project plan that has a predictive modeling component and a strategy to extract and transform data from a de-identified clinical database. Finally, in Part 4, I will ask you to build off the previous 3 projects and perform risk stratification analyses, at least conceptually, using the de-identified Medicare claims database. This last part may require some documentation such as creating data dictionaries and a report summary where you interpret what the information means based on the context of the data. Healthcare analytics is about solving real-world problems, helping both the patient and their care team provide the best care possible, all the while helping the health system improve their bottom line. It's very interesting and exciting work, and we have a lot to cover, so let's dive in.